Hey, hi everyone. So I'm going to give us a quick overview of the femoral triangle, the anatomy triangle. Okay, so two important structures we need to bear in mind when we're thinking of the femoral triangle. And the first is the anterior superior iliac spine, AS, and the next is the pubic tubercle. Now, in between these two, you have the inguinal ligament. Good. Now, the next structure we need to be interested in. So this is the lateral end, that's the medial end. Yeah? So there's a muscle that runs from the medial end that way. Now, that muscle, this muscle here, is called the sartorius muscle. It's the longest muscle in the body, is otherwise called the talus muscle. There's another muscle that runs this way. It's called the adductor longus muscle. Now, eventually what you end up with is you end up with a triangle, isn't it? And the triangle, the superior border is formed by the inguinal ligament. The medial border is formed by the medial end of the sartorius muscle. And the lateral border is formed by the medial end again of the adductor longus. Now, with this said, there's another important concept. So the floor, which is within, is formed by something called IPPA. Yeah, and IPPA is from medial to lateral. So let's continue. So it's going to be more like IPPA. And the first I is iliacus. The second, the P is psoas, what some people call the iliopsoas. And then you have the pectineus, and then you have the adductor longus muscle. Now this forms the floor. Now the roof of that, if you think of it this way, the roof covering, the roof covering that. So let me paint it in green. Is formed by the fascia lata, which on the medial end forms on its most lateral end forms the iliotibial tract, which on the top of it has the tensor fascia lata. Good. So with this said, let's look at the interior of the femoral triangle. So I'm going to quickly draw a new one. So remember, we have medial, lateral, we have that, and we have that. Now the structures within, so this is our medial end, this is our lateral end, isn't it? Now the structures from lateral to medial, you can remember them with something called navy or navel, meaning the first is the nerve. So that's the femoral nerve. So the femoral nerve arises from L2, L3, and L4. The next two structures are generally within what you call the femoral sheath. So you have something like that. And so N is nerve, artery. So you have the femoral artery. Now the femoral artery, if you remember the anatomy, is a continuation of the external iliac artery. Good. Now, next to it is the femoral vein. So that's nerve, artery, vein. Then you have space here. The space here is the femoral canal. So this is the femoral sheath, generally formed posteriorly by the transversalis fascia and anteriorly by the part of the external oblique aponeurosis. Now here is a free space, usually containing nothing, which is called the femoral canal. Or most times it will contain lymph nodes of Cloquet, and is there to allow expansion. During blood flow, there will be expansion of the arteries and veins, so it accommodates that. Now, the femoral canal does have, so essentially what you have in the femoral sheath, you have the artery and vein, and then you have the genitofemoral branch of the femoral nerve, but the nerve itself is not in the femoral sheath. Now the canal is empty except for Cloquet, and it allows for expansion of the vessels. Now with that said, the boundaries is posteriorly, the canal is posteriorly bounded by the pectineal ligament. Anteriorly is bounded by the inguinal ligament. Now, if you look at laterally, is bounded by the femoral vein, and then medially is bounded by the lacunar ligament. Good. Now, what is the importance of the femoral canal? It can lead to femoral hernia. Now, a cheap way to remember femoral hernias are the femoral starts with F. They are commoner in females, and they are also prone to strangulation because this space and the sharpness here is much. Therefore, they are prone to strangulation. And the other thing you may want to remember that is inguinal femoral hernias could be repaired using a high or low approach or a transverse approach, and repairs like Lutensine McEVD come into play. All right, so I hope you find this helpful. So that's a quick recap. Remember that we have the anterior superior iliac spine laterally, the pubic tubercle medially, the inguinal ligament running that way. Then you have the sartorius forming the medial border, the adductor longus forming the lateral border, but for both muscles is the medial end. And then you have the floor formed by the iliacus from medial to lateral, iliacus muscle, psoas muscle, pectineus muscle, adductor longus muscle. Then remember the roof is formed by the fascia lata, which is thickened laterally to become the iliotibial tract, helpful for hyperextension of the knee and stabilizing the knee. And on top of it is the tensor fascia lata. With that said, the next is we look at the femoral sheath. And I said how to remember the structures within the femoral canal is navy. The nerve itself, it's outside, but its genitofemoral branch is within the sheath. And then you have the artery and vein within the sheath. The sheath generally is formed anteriorly by the aponeurosis of the external oblique, and then posteriorly by the transversalis fascia. And then next you have the femoral canal, which generally contains nothing except the lymph nodes of Cloquet and is useful for when the vessels expand. And then we talked about the root values of the femoral nerve being the second, third, and fourth L. And then we said the femoral artery is a continuation of the external iliac artery. And then we talked that the boundaries of the femoral canal is posteriorly the pectineal ligament, laterally the femoral vein, medially the inguinal ligament, the lacunar ligament, and anteriorly the the anteriorly the inguinal ligament, and then that femoral hernia are commoner in females, are quite common. They are known for strangulation, and then they can be repaired using the high or low or transverse approach. And some of the named procedures include Lotensin and McEVD repair. Thank you, and please like and subscribe and support the channel and share with your friends.